Let me share a real example of how quickly measles can spread and why vaccination is so critical. I'm Dr. Leslie Treese, a board certified pediatrician. A single unvaccinated child arrived in New York City on an international flight and returned to their community in Brooklyn. This community, where MMR vaccination rates were just under 80% in 2019, became the center of a measles outbreak. The first case presented to the emergency room with symptoms including red, inflamed eyes, abdominal pain, and a rash. This is a classic case of measles. Measles is one of the most contagious diseases, and while the MMR vaccine is 97% effective after 2 doses, herd immunity is crucial to protect those who can't be vaccinated. Experts estimate we need 95% of the population fully vaccinated to maintain herd immunity. That one unvaccinated child sparked an outbreak that resulted in 649 documented measles cases over 10 months. Among those, 37 developed pneumonia, 49 were hospitalized, and 20 required ICU care. Some complications included permanent vision loss and even the risk of fatal neurodegenerative disease years later known as subacute sclerosing panencephalitis. The outbreak cost $8.4 million to control, and vaccination rates in that community rose from 80 to over 91%. However, measles cases are rising globally, up 20% compared to last year. Here in the U.S., we're also seeing a resurgence with current vaccination rates for kindergartners dropping below 93%. Globally, many children lack access to vaccines, but in the U.S., false information is the main reason for declining vaccination rates. Before the measles vaccine program began in the 1960s, nearly 4 million people were infected yearly, and around 500, mostly children, died. The success of vaccines has made these risks feel invisible, and outbreaks like this remind us why vaccination is so important. Let's continue to protect our communities and prioritize public health. Thank you and have a nice day.